I'm the Clinical Program Director for the Mobile Crisis Response Team with Community Health Resources. That means I have the clinical and administrative oversight for a Mobile Crisis Response Team that covers 17 towns. The Mobile Crisis Response Team gets referrals from anyone and anyone in the community, and when I first started 9 years ago, we got very few referrals from the police departments, and we had very little contact with the police departments, which was concerning because there's a high number of persons who are calling 911 when they're in a mental health crisis. They're not calling the crisis teams. And so we needed a way to partner together to reduce the number of 911 calls. And as they became CIT, Crisis Intervention Team trained, I approached the departments and said, since you're CIT trained, let's have monthly meetings. And with the monthly meetings, we developed kind of a protocol that we would go through every police emergency evaluation request form. In Connecticut, it's called a peer. We would review every peer that was written for the month. We would identify people who were being peered by the police and sent to the hospital multiple times per month. And for those calls, we would identify what maybe the psychosocial stressor was, what possibly the person needed, most likely mental health treatment. And so this open communication started happening. And when we would meet for meetings, I started suggesting, do you think possibly when you write a police emergency evaluation request form and send someone to the hospital, could you let us, the crisis team, know this so we could call the emergency department? Because most of the time we would know this person, so we could provide the clinical to the emergency department and ensure that the person gets the best care possible. I'd really like to encourage mental health agencies, in particular the mobile crisis teams, to partner with their local police departments. It's such an important partnership. And I know what clinicians will always bring up is the issue of HIPAA, but we have working memorandum of understandings, MOUs, with all of our departments. With each meeting, we have a sign-in sheet that states there's an understanding that what is said during this meeting is confidential between the police department and CHR, and that CHR holds the information, and that the information being shared is for treatment planning and crisis planning. And that's really the structure and the reason for the meetings to occur, is that we're being proactive rather than reactive in terms of crises, and we're trying to prevent crises. With this police mental health collaboration, what has been so wonderful is I'm able to provide information to the police departments as well, things that are changing in the state, things that are changing in terms of mental health law, things that are changing with programs. And also in building these partnerships, we were finding that the mental health training and the skill building that was happening with the police, with the crisis intervention team training, was allowing the police to use verbal skills and de-escalation techniques. So there was less use of force. People were getting the mental health treatment they needed. They were not entering the criminal justice system. So it was a win-win for everyone.